How does community involvement impact mental health? First, let's define mental health. As explained by mentalhealth.gov, quote, this includes our emotional, psychological, and social well-being. It affects how we think, feel, and act, end quote. It's also affected by several factors that we'll touch on soon. In the past, many cultures have viewed psychological disorders as evil or demonic possession, or being caused by imbalances in bodily fluids. But as science developed, these outlandish beliefs have declined. Mental health facilities were created and successful for some time, but unfortunately, that didn't last long. Despite attempts to improve living conditions, many facilities and asylums were grossly lacking in safety, health measures, proper funding, and adequate staffing. Since the beginning, stigmatization and discrimination towards the mentally ill have been present, which remains true today. Over the years, there have been many developments in the mental health field. Compared to the past, there are now many more resources, mental health professionals, training and education, and openness and awareness into the complexities of mental health and associated disorders. However, these improvements don't equate to perfection. Many factors affect the education, diagnosis, treatment, and acceptance of mental health, such as financial barriers, lack of appropriate mental health professionals, lack of education, information, and understanding, and social stigma. Even though the breakthrough law, the Affordable Care Act, or the ACA, requires insurance companies to provide coverage for mental and behavioral health, it's often not enough for adequate treatment and limits effective access. Paying out of pocket isn't a realistic option for many individuals, so they must either rely on free mental health services, hotlines, and centers provided by the community, or simply receive no treatment or therapy at all. In addition to insufficient resources, the stigma often attached can prevent individuals from seeking help. This ties in with a lack of education and awareness. Physical ailments can be easier to identify and understand, while mental illnesses can be challenging to recognize because they stem from our minds and only the symptoms are visible. Instead, these behaviors may be pushed aside as simply personality traits or character issues. Additionally, the fear of discrimination in school, the workplace, families, churches, or social circles can prevent individuals from seeking treatment, which leaves a trail of unresolved mental health disorders or crises. All of these factors also play a role in the community as a whole. So, what is a community made up of? People in communities have shared beliefs and interests and bond over shared interpersonal connections. Consider schools, where you work, community gardens, art and music groups, religious sanctuaries, and libraries. These are just some of the components of a community. As stated by the National Alliance on Mental Illness, quote, community is not just an entity or a group of people, it's a feeling. It's feeling connected to others, feeling accepted for who you are, and feeling supported. Having connection can help us feel wanted and loved. It's critical for us to thrive, especially for someone with mental illness who is already experiencing the common symptoms of loneliness and isolation, end quote. In short, communities provide us with a sense of purpose, support, and belonging. While they can provide priceless resources, the challenges they face greatly impact how beneficial it's capable of being. If there isn't enough funding, enough education, enough training, or empathy, communities can fail to provide what individuals need. In anonymous surveys conducted for this research project, 72% of participants stated that they have wanted help with their mental health currently or in the past, but were unable to due to lack of financial resources, information, or both. Insufficient government or private funding for mental health services prevents a large majority of individuals from being able to access what they need. As stated by the American Hospital Association, quote, behavioral health care has long been underfunded, underappreciated, and stigmatized, and the pandemic has intensified the unmet need for services and has led to heightened difficulties for individuals with behavioral health conditions in accessing care, end quote. With 66% of individuals reporting moderate to severe interference with mental health and their social involvement due to the pandemic, the need for mental health professionals is more urgent than ever. Unfortunately, that need isn't being met. Without their help, individuals are left with unresolved mental health issues, only exacerbating their symptoms and associated thoughts and behaviors. Overall, 64% of the survey participants reported that they are currently struggling with their mental health, and specifically among minority groups, it rises to 83%. One-third of all respondents have been discriminated against at work, in their community, or both due to their mental health condition, and nearly 40% feel like they're unable to ask for help in fear of discrimination. 99% of participants believe there is a stigma surrounding mental health, whether it's at home, school, work, church, their friend circle, their community, or society as a whole. For something so commonly experienced by a majority of its members, why is there such a high rate of reported stigmatization? As mentioned earlier, stigma has existed since the concept was initially developed, but that doesn't mean it was or is understood. Understanding comes with education and awareness, but with insufficient information and resources, how can we and future generations end this cycle of stigma? 66% of participants stated that they weren't introduced to mental health in school, and half of the current teachers reported that mental health isn't included in their curriculum. 92% of the general population believes it should be taught in school, while some specify that it could be, but with restrictions. They explained that they believe only trained counselors or medical professionals should teach this, which was further supported by many teachers. As one teacher explained, they aren't trained therapists, but they're expected to be and treated as such. Increasing the amount of counselors on campus or having social workers present in the classrooms would be an ideal situation in the eyes of those in education. Participants stated that they believe incorporating mental health into school systems would help prevent suicide and school shootings, teach healthy coping mechanisms, validate their emotions, remind them that they're not alone, set emotional boundaries, learn effective communication skills, promote empathy, and ultimately reduce stigmatization surrounding mental health. As one participant summarized, many mental health issues develop in the childhood years and children get labeled. Those labels carry judgment, condemnation, and social and self esteem issues. I wish people could just realize each person is individual by design. While education begins in childhood, it should always continue on into adulthood and into every profession, like a profession in law enforcement, for example. All police officers, firefighters, and EMS workers are required to take training courses on mental health, but many participants stated that they felt this wasn't sufficient enough. While law enforcement as a whole may not always be up to par in regards to mental health, there are dedicated units where this is the sole focus, such as the Crisis Intervention Team, or CIT, in the San Antonio Police Department. CIT was formed because of a fatal outcome during a mental health crisis at the hands of a police officer. Without the education and awareness of how to properly manage someone experiencing a crisis, fatalities will occur, as we have seen in history and more in recent years. Officer James Williams of the CIT explained the historical relationship between law enforcement and the mentally ill. Because of their lack of knowledge and their initial response would be to arrest them, quote, therefore, most of your jails around the nation became the biggest mental health facilities around the world, end quote. One survey respondent stated that more than 30% of their jurisdictions arrested individuals were those suffering from mental illnesses. 39% of the participants stated that they have been arrested and it was done so while they were experiencing a mental health crisis. The long lasting effects of mass incarceration are devastating for communities, and the lives of the mentally ill confined without treatment can lead to detrimental ends. Insufficient or improperly allocated funds halt the development of more much needed, life saving mental health units such as CIT. There are now 2,800 CIT programs across the US, offered in 15% of all police jurisdictions. While it can be easy to frustratingly point out areas in need of improvement, it's incredibly important to acknowledge the growth and positive impacts that have been made. As Officer Williams explained, people can survive and have a great quality of life, own businesses and work jobs, and have relationships with mental illnesses. And so that's our goal, to see them back to that quality of life that they need, to keep going and have that hope for the next day. Hope. That's what we all need, isn't it? Hope. It's what our loved ones and cherished friends remind us to have in our darkest times and brightest days. It's what a thriving community provides to its members, and even when faced with obstacles and setbacks, hope keeps it moving forward. We all struggle. Many suffer from depression, trauma, discrimination, substance abuse, anxiety, and so much more. We all endure a tremendous amount and expect even more from one another. Despite all of the limitations, disparities, inadequacies, and stigma surrounding mental health, it's clear through this research that so many individuals recognize the importance of early prevention, education, and awareness. As one participant stated, quote, talk about it, make it normal. I halfway joke but agree 1000% when I quote Pete Davidson about how if you can't make your own serotonin, store bought is perfectly fine. End quote. Mental health is health, and we all need help with our health from time to time. We are a community, and our thoughts, beliefs, and actions greatly impact one another. Whether it's your entire town or your four closest friends, that is your community. That is your family. How does community involvement impact mental health? You tell me.